TB notification is an easy, simple, three-step process. Step 1. Registration of healthcare providers and facilities. Any healthcare provider who provides part or all TB services, such as diagnosis, treatment, and prevention, must register by accomplishing the TB Service Provider Information Form. This can be done online by visiting the website itis.doh.gov.ph/register or itis.doh.pbsp.org.ph/register, or offline by mailing the form via post to this address. Once validated, the healthcare providers are entered in the database of the Integrated TB Information System, or ITIS, and are provided with ITIS accounts. To facilitate validation of healthcare provider details, professional medical societies are advised to submit an updated roster of their member doctors by region every year to the NTP. Healthcare providers who practice in hospitals and clinics can register through a designated TB notification officer of the facility.
Step 2. Identifying a TB patient. Presumptive TB patients have symptoms or signs,
including radiologic findings suggestive of TB. Patients with high clinical risk factors like diabetes, smoking, previous TB treatment, and HIV, or among high-risk populations like those living in congregate settings, the poor, and elderly, should be screened routinely for cough of any duration or through chest X-ray. All presumptive TB patients should undergo bacteriologic confirmatory tests using any of the following. 1. WHO recommended rapid diagnostic tests like Expert MTB-RIF, which is the primary diagnostic test, or TB LAMP, which is the alternative. 2. Direct microscopy. And 3. TB culture. Expert MTB-RIF is now considered the primary diagnostic test for TB, replacing microscopy because of its high sensitivity and specificity, fast turnaround time, and the ability to detect rifampicin resistance. TB LAMP is an alternative WHO-recommended rapid diagnostic test which also replaces microscopy if available. Those who tested positive in any of these tests are classified as bacteriologically confirmed, or BC. All those who reported negative in any of these tests but are clinically assessed to still have TB based on imaging studies, non-responsive to antibiotics, and with a decision by a clinician to give full course of a TB regimen are classified as clinically diagnosed, or CD. After diagnosing a patient to have TB based on bacteriologic status and site of involvement, we can now notify the patient regardless whether they were initiated or referred for treatment, including those who refused treatment. Step 3. Notification and reporting of TB cases. All TB patients are notified at 3 time points. First, upon diagnosis. Second, upon initiation of treatment. And third, upon declaration of treatment outcome. It is possible that one or multiple healthcare providers report the same TB patient based on these time points of patient contact. The duplicate notifications will be filtered by ITIS. All TB cases seen during the month will be reported at the end of the month. 0 cases must also be reported. Always follow the steps of notification. Start by informing the patient the need to notify his or her case, which is not a violation of the Data Privacy Act. Then, accomplish the TB notification form manually or electronically, whether notifying the patient for the first time or updating the previous TB notification form submitted. Finally, submit the accomplished TB notification form online to the designated TB notification officer of the hospital, clinic, or nearest health center for encoding in ITIS, whichever is applicable or more convenient to the provider. Online or manual TB notification may be delegated to an assigned encoder of the physician or health facility. For online TB notification, visit itis.doh.gov.ph/mandatory notification or itisdoh.pbsp.org.ph/mandatory notification. Notifying TB cases is an international standard of TB care. It ensures that patients are diagnosed properly, treatment delays are prevented, and TB transmission and emergence of resistance are decreased because patient adherence is monitored. The data from notification activities will assist the National TB Control Program undertake the necessary public health measures, plan for the required logistics, and monitor progress towards TB elimination. Remember, notifying only takes a little of your valuable time, but it will certainly go a long way to reduce the number of missing cases in the country. It's time we leave no one behind as we move together towards a TB-free Philippines.